Good morning. Clock shows 9:01. I'd like to begin. This is the Bidders Conference for a request for quote presented by Workforce Solutions Greater Dallas to procure our health insurance for our team at the board staff. Hopefully you're in the right room and we can proceed. Ash, if you'll post the copy for me real quick.
Sorry, Mario, I'm disabled. Oh, Mario's doing it. Okay, thank you.
Thank you, sir. If you could come in close on that top box, Mario. Thank you so much. I'm Laurie Bouillon-Larea, President of Workforce Solutions Greater Dallas. I have with me our Chief Financial Officer, Ashley Werner, and our Executive Vice President, Demetria Robinson. The RFQ was released 1 o'clock on September 28th. We received several questions this morning before the 8 o'clock deadline. Bidders Conference, of course, is today and the most important date. Proposals are due by noon Central Daylight Time on October 12th. We hope this provides adequate time. We understand that this is a bit difficult. We also understand that lots of the rates are not in for the new year. This would provide benefits for our team from January 1, 2022 to the end of 2022. Understanding we expect increases, we're trying to economize as best we can. I have received questions. If you'll just keep that up, Mario, I'll pull up our questions that were received. And oh, apologies all, something popped up there. Teams, is that you, Mario? Or is that on my end?
No, that's me, sorry.
It's okay. Teams tries to take over. I've noticed that.
Yeah, sorry. I have Teams going too.
Not a problem. Let me get back to our sheet and I'll read what was received this morning if I could. I believe it's here. Here we go. I'll read the questions into the record. These questions will be published on our website with the answers, but just for this morning's bidders, since you were kind enough to join us, let us take up what we received. One question. To ensure a competitive quote, could you send summaries of the following insurance benefits currently offered? And that was vision, dental, long-term disability, and group life. This RFQ outlines the full list of services as health insurance for a small group. That is what we're seeking. As stated on page 4 of the RFQ, we are not procuring for anything at this time other than healthcare. However, let me explain our process. Healthcare is quite costly, even for a group as small as ours, as you're familiar. The other insurances do not cost what would cross the threshold. So we have left those in play, particularly we're thinking of expanding or extending those, but we have not had that conversation. If you would like to provide information to us in the package, you're welcome to do so. I apologize that I'm not prepared to release additional personal information on our team unless it is pursuant to the health insurance. So be in touch with us with any Q&A to the web portal, if you would, about insurance quotes, or in this call would be appreciated. Tell us what you will need for the insurance, the health insurance quotes. Other questions? One question was wanting to verify that we are looking for only healthcare, and that is correct. The RFQ outlines a full list of services, but on page 4 of the RFQ, it specifically states healthcare. Please verify the effective date. The coverage does begin January 1, 2022 for the entire calendar year. There is a very lengthy question about whether or not we are pursuing non-Affordable Care Act compliant. I would like to state that we are predominantly government funded. Most of our funds are federal funds processed through the state of Texas. We are quasi-governmental through the state of Texas. We have not pursued and don't intend to pursue ACA non-compliant policies, even though we know there would be an advantage. So to that issue, we are looking at the Affordable Care Act compliant plans. Again, you're welcome to propose anything that you think would be interesting or in our best interest. I'm just answering that question. possible that carriers will not have the rates January 1. I've sort of addressed this. We're familiar with the challenges of obtaining accurate rates this early. However, our last board meeting is October. We need time for conversation with our team. So this is the latest we dared ask for these rates. Hopefully crossing into the last quarter, as of Friday, you will at least be able to give us a sketch of what those rates would be January 1. We do understand it's difficult, but this is our plan. Last question on there. Highly recommend you requesting the HB 2015 report immediately. There is not time for us to do that, nor did we contemplate actually doing that work. Again, it's a lengthy question. This is the information we are sharing at this time. So hopefully we can get some impression of what the bids will be for January 1, and that we understand there will be more negotiation and more detail to follow once we have selected from the respondents to the RFQ. Having presented that, I will open the floor to questions. Any of you, Mario, if you could open all accounts and allow people to ask their questions. I'll start with the 214 number. Anyone on the telephone wish to ask a question at this time?
Yes, this is Clint Jackson with Lockton. Do you have an idea of the total spend on the health insurance at this point over the last 12 months?
The total span?
Spend, like how much premium you've paid?
Oh, of course. Ashley, for just what an annual sum has been. I know you and I have looked at that.
It's just under $500,000, $450,000. That's been the annual premium.
Thank you.
You're welcome.
Thanks for the question, Clint. I thought it was in the information, but it's not there. So apologies for that.
That's fine. Thank you.
The 214 number still? I don't see that one opening. Mr. Markentel, any other questions?
I have one question. This is Clint again. Do you prefer a flat fee, or would it be appropriate to assume just standard commissions under this process?
Your question is perplexing. We have only had, I don't believe we've paid a fee. Ashley, am I correct?
Yes. Well, is the question, are you asking a flat fee for the broker or a commission for the broker? Am I understanding the question correctly, Clint?
Correct. Well, you have the option of allowing the broker consultant to accept commissions, or you can have them provide you a flat fee, annual fee that would be paid monthly.
Gotcha.
And then our work would be net of commissions.
Gotcha.
Let me just explain a little bit on the procurement side of that. I think in our business, Clint, it's easier if the commission is wrapped into the policy. Otherwise, it then becomes the art of negotiating commissions that will then be inspected for procurement purposes. It's the same way in our real estate. The commission for the real estate broker is usually we understand, wrapped in the lease, but we are not negotiating for that fee as ardently as we are focused on the price of the item. We could do it both ways. You can present it to us both ways. That would be fine.
Okay. That's fair. Thank you.
Other questions? This is your time. And in fact, your only time. We will negotiate with anyone after the process, but we do need these bids back by the 12th. We need to go to our board immediately thereafter and talk about the advantages. I expect that someone will come up with a plan different than the Blue Cross Blue Shield that we have. Our Blue Cross Blue Shield has served us well. It may be, in fact, easily pared back for anyone that's shopping for us, staying Affordable Care Act compliant, but looking at those things that would not be detrimental to our team or frustrating for the team. It is a high deductible plan, very high. And as you see in our negotiations, we do take care of a lot of benefits for our staff, but it does mean cost to the staff. So anything that would be a staff savings would be appreciated. questions, other conversation? It is your moment. I hate to end the call that quickly. Are we sure everyone has what they need? Either the 214 number or Don or Clint, but I think Clint has, we've heard him and that's thankful, Clint, because I need those questions. Don, anything? And I apologize, I don't know who's on the 214. Would you come on and introduce yourself? Or is that somebody who's also on Zoom?
It might be someone who's also on the.
Okay.
I believe that may be me.
Okay, Clint, perfect.
Yeah.
Perfect.
So I guess is there a place where they could submit questions after the
The
fact?
deadline was 8 o'clock this morning, but thank you,
Okay.
Mario. We've taken the questions. We are going to put them out on the portal so they can be read by anyone who missed the call. Was there any other clarification, Ashley, that we needed to make? Anything else that we thought of?
I can't think of anything, and I think you answered all the questions that we received before the deadline.
Let me go back and see if there was any other conversation.
I have one more question.
Sure.
Is there an incumbent agent or broker on this account?
Yes, there is.
May I ask who that is?
Public information. It's Mr. Marcantel, who's also on the call.
Okay, thank you.
Sure. I know there's a need for more census data, and we did work on that, but due to a lot of pressure from the state on protection of personal information, we were very hesitant. Also, when people want dependent information, you really cannot share minor information any longer online. So it makes it very difficult for us. And I'm sure it makes it difficult for you as well. But this is one or two of the things we have been, the whole system has been audited by AT&T in the last year and a half for potential weak points in our system or lack of protection. And we're going into a full throttle as of November of all things being really locked down. So again, apologies. Once a situation or broker is identified, we will share as much information confidentially as we can, very little by email or internet.
That's right. And all that information is in that supplemental schedule sent to the bidders.
It's the best we could do, and that's why it wasn't posted on the website. Any other questions? Having none, it is 9:15. I hope this has been helpful. It's a brief one, but we appreciate both of you joining us today. Thank you so much. And that concludes our bidders conference.